In other news this afternoon, the latest data from the National Institute for Communicable Diseases, that's the NICD, shows that there were no COVID-19 related deaths in South Africa in the past 24 hours. There were 183 deaths recorded, according to the NICD, but these were not part of an ongoing National Health Department audit. It's a bit confusing, if you ask me, but let's get some clarity now from Ramphelane Morewane, the Acting Deputy Director General for Primary Healthcare at the National Department of Health. Good afternoon, sir. Just clarify for us, were there any COVID-19 related deaths? Is the number 0 the accurate number for the period under review?
Yes, good afternoon, and good afternoon to the viewers at home. The number is correct, and as we have previously stated that the numbers we reported are the number over a 24-hour period. Now, we aren't saying that there may not tomorrow be any numbers that come up, but we're saying for the cycle that we're reporting on the numbers that were deposited into the system, we picked up that it's a 0 case, right? So I think that's where we stand.
So it's as accurate as for the past 24 hours?
That's correct.
And now the NICD, as I was saying in my intro, reporting that there could be a backlog. So this number 0, sort of from what we've been seeing as we track the numbers over a period of time, is the first time we've recorded 0 in a long time or ever. Am I correct, sir?
No, you're very correct. In fact, let me just explain how we do it. It's a number of deaths out of those that were tested and reported the past 24 hours. But if tomorrow, for an example, we were to come in with a number out of our own audit, and the number could be 1, 2, 3, any number, it won't necessarily relate to the one that we've reported last night. It may refer to many others of the previous times that would have been picked up as we do the audit. Because in terms of statistical management, now and again, you've got to go back, look at the numbers that you've pulled through, and see if you've not missed any or 2 numbers. And for me, that's a standard practice for management of numbers. Otherwise, once you make one counting, you may think that you've done everything well, and only to realize later on that, in fact, these numbers that you've left behind. That is where when numbers become known, they then get announced or reported in the system again. Because that assists us for people to have more confidence in our system of reporting, so that we are not seen, or it's not being seen as if anything is being swept under the carpet. Because we need to account for every number that has been reported through the system in terms of death registration.
So that's hence is why you would see the fluctuation, so to speak, in what you report on a daily basis. 2 days ago, I'm looking at the graph that you sent out on your Twitter account as a Department of Health, 46 daily deaths. That was 2 days ago. And then a day ago, 38 daily deaths. That was then. And then the latest one, about 16 hours ago, 183 deaths. But in the period that you are recording now, the last 24 hours, is still showing as 0.
Yes. Yeah. In fact, you're right that those numbers that you're recording, remember now, you're not even dealing with the backlog. You're simply showing the numbers for the previous set of 24 hours, the past 36, 48 hours or so. But I'm saying, as it happened previously, there would be a time where a province will then say, we have now done an audit, and now we're coming forward that of those that we're reporting as daily cases, the following are now the numbers that have been lying either very far-flung facilities that could not report the numbers in time, or the deaths that could not be reconciled from other areas where people have passed away. So all those coming together, they're part of the audit that continuously going on. So what we don't do, we actually want to have a way of putting together all sources or systems that are putting that together so that we are able to say, indeed, here is where we stand. So we're not even naive that this approach that we're using may continue for some time to come, because as I said, when you work with numbers, you now and again need to go back. But the problem could be if you don't do that, because then you'll not be able to fully report on the numbers that you've actually been
from what
as reported deaths.
Yeah, Mr. Morewane, from what you are saying, if I may just paraphrase a little bit my understanding, the next statistics that you will issue, the next batch of data that you will issue might reflect a certain number, but not zero, because of what you've just explained. We need to understand that there's a lag sometimes, there's a delay, far-flung areas feeding into the system, and you have to ensure the accuracy of the data as well to make sure that those COVID-related deaths are indeed of people who had tested positive by the time they had died.
Yeah, no, your understanding is correct. And at the time that we do that, we'll qualify it to say the following are the number of deaths that happened in the past 24 hours, but then the rest are those that are coming in as a backlog. So we always make that distinction so that members of the public are also able to follow the manner in which we are reporting.
Okay,
so,
I know
your understanding is correct.
Thank you, sir. I know you're not the NICD, but you do work for the health department. From the data you're seeing recently, just an overriding question, Mr. Morewane, there's a very visible decline even in the number of deaths that you're recording due to COVID-19. If you look back where we were nearly 2 years ago in March 2020, when President Matamela Ramaphosa declared the national state of disaster and started the first lockdown in the month of March, we are at the lowest side of COVID-19 related deaths that we've been in 2 years. Is that a correct reading?
It is, and as you, I mean, it's the lowest as you're rightfully saying it. That, but again, remember, we are now at the lowest level of the peak of the fourth wave, right? We're at the lowest level, and this is characteristics of the lower levels of waves. Where the number of cases against the number of deaths, are lower. Of course, the lowest ever it's now, but the characteristic of waves has been that at this particular point of time of the lowest level of the wave, the numbers will naturally go down, and that has been the trend. I mean, wave 1, wave 2, wave 3, like that. If you look at them, they've always been coming down like that, and I guess, I mean, because as I said, it's a number of deaths as a proportion of the number of people that tested positive for that particular period.
Yeah, thank you very much. So, I mean, to have recorded no deaths in the last 24 hours is no surprise, and there could be a different number in the next period. Thanks for clarifying. Thanks for your time, Mr. Ramphelane Morewane, the Acting Deputy Director General for Primary Healthcare at the Department of Health.